Hello everyone, my name is Alicia Nunez. I'll be doing my case study over tubular carcinoma. Tubular carcinoma is a type of invasive ductal carcinoma, or IDC, that develops in the milk ducts of the breast. As far as patient symptoms goes, in most cases it's actually asymptomatic. If it's been in the breast for a while, it may create a lump that can be felt over time. The lump will feel hard or firm. The patient might experience breast swelling, unusual nipple discharge, or changes in the breast such as dimpling, redness, or dryness. The pre-mammogram information includes anything that the patient might have a question on. They should go ahead and write it down and bring it to their appointment. The patient should receive all the general instructions for a mammogram. This is regardless if it's a routine exam or if there was already a suspected lump found. They should bring any prior imaging of the breast. Do not wear deodorant. Dress appropriately so they can change into the gown easier. And they should ask their questions from the list so that no question is forgotten. The patient is also advised to do a little research on their own to see what a mammogram is like and what will be happening that day. To diagnose, a patient can actually conduct a self-exam, or a physician can conduct a physical exam of the breast, checking to see if there's any lumps, anything like that. Most cases are diagnosed from a routine screening exam. It's important to remember that it can be asymptomatic. A mammogram is usually the first step in detecting tubular carcinoma. Additional imaging, such as an ultrasound or an MRI, may be necessary. Tubular carcinoma is similar in appearance to true invasive ductal carcinoma, so using other modes of imaging helps differentiate these two. A biopsy is the most accurate and also the final step in diagnosing tubular carcinoma from other types of malignant and benign tumors. So the description of the pathology, it's usually less than 2 centimeters in diameter. Tubal carcinoma will always be very small. It's an irregular lesion with infiltrating borders. It has round angular tubes, which is suggesting the name, lined with single layer of epithelial cells. But these tubes are not exactly tubes, more like a string of beads on a necklace. Characteristics of the pathology. So, since the size of the tubal carcinoma is so small, it tends to stay in the breast. It typically does not travel to other parts of the body, meaning this type of tumor doesn't really affect normal physiology. Causes of the pathology. The biggest cause is your family history or your genetics. If you're receiving hormone therapy and or radiation therapy. Lack of exercise and obesity is a common factor. Excessive alcohol consumption, or not having a full-term pregnancy by age 30, or not breastfeeding, since this is the type of carcinoma that affects the milk ducts. Tubal carcinoma, aka mixed tubal carcinoma. So true tubal carcinoma will not have traces of other types of tumor in it. The more tube-like it is, the truer it is to being tubal carcinoma. The less tube-like it appears to be, the more likely it is to be mixed or contains traces of ductal carcinoma in situ, or DCIS. So the statistics of tubal carcinoma are actually pretty rare. They make up 2 to 6% of all malignant tumor cases, but around 40% of these cases have had a family history of tubal carcinoma. Only 10 to 27% of all cases have metastasized to the axillary region, and it has a great survival rate of up to 97%. Treatment includes a lumpectomy, which is removing part of the breast, and that you can see right here kind of looks like this. A mastectomy, which is removing all breast tissue. Radiation therapy right here, And then you also have hormone therapy if the tumor is tested positive for hormone receptors. Chemotherapy, most likely for the rare cases that have spread, and targeted therapy. Here are my sources. Again, my name is Alicia Nunez. Feel free to ask me any questions regarding tubal carcinoma.